Welcome to Luck Scout Psychology. Today, we're diving deep into a complex and often misunderstood personality disorder. It's called Antisocial Personality Disorder, or ASPD. This isn't just about someone being difficult or unpleasant. ASPD is a serious condition. It affects how a person thinks, feels, and interacts with the world. The goal today is to shed light on ASPD. Let's begin our journey into understanding antisocial personality disorder. Antisocial personality disorder is characterized by a persistent pattern of disregard for others. People with ASPD often violate the rights of those around them, showing little to no remorse for their actions. Their behavior can be charming and manipulative one minute and aggressive and destructive the next. This unpredictable nature makes it challenging to form healthy relationships and maintain stability in various aspects of life. ASPD runs deeper, affecting their thoughts, emotions, and their very perception of the world. Understanding this is the first step towards breaking down stigma and fostering a more compassionate approach to this complex disorder. We'll delve further into the specific symptoms and behaviors associated with ASPD in the sections to come. Why is it crucial to understand antisocial personality disorder? Because it impacts everyone. Individuals with ASPD often struggle in their personal and professional lives. Their behavior can have devastating consequences for themselves and those around them. Families and friends often bear the brunt of their actions, left feeling hurt, betrayed, and emotionally drained. ASPD is also linked to criminal behavior, substance abuse, and other societal issues. By understanding ASPD, we can better protect ourselves and our loved ones. In the following sections, we'll explore the causes, diagnosis, and treatment options available for antisocial personality disorder. A hallmark of antisocial personality disorder is a blatant disregard for rules, societal norms, and the rights of others. Individuals with ASPD often engage in behaviors that directly violate established laws and social expectations. This disregard isn't simply about bending the rules, it's a deeper lack of concern for the potential consequences of their actions on themselves, or more importantly, on those around them. They might lie, cheat, or steal without experiencing genuine remorse or guilt, viewing these actions as necessary means to achieve their desired ends. This disregard for societal rules often leads to conflicts with authority figures, legal troubles, and strained personal relationships. In the next section, we'll delve into another prominent feature of ASPD: deceitfulness. Deceitfulness and manipulation are central to antisocial personality disorder. Individuals with ASPD are often skilled at presenting a charming and charismatic facade to the world, masking their true intentions. This ability to manipulate others serves their need for control and self-gratification, often leaving a trail of broken promises, shattered trust, and emotional damage in its wake. They might use aliases, fabricate elaborate stories about their past, or engage in con artistry, all to exploit others for personal gain. This lack of empathy and disregard for the emotional well-being of others make it challenging to establish genuine connections with individuals with ASPD. Let's move on to another significant characteristic of this disorder: impulsivity. Impulsivity is a defining characteristic of antisocial personality disorder, often manifesting in reckless and irresponsible behaviors. Individuals with ASPD struggle with impulse control, making decisions on a whim without considering the potential long-term ramifications of their actions. This impulsivity can permeate various aspects of their lives, from substance abuse and risky sexual behavior to sudden career changes and unstable relationships. This pattern of impulsive behavior can have devastating consequences for both the individual with ASPD and those around them. This impulsivity isn't simply a matter of being spontaneous or adventurous, it's a deeply ingrained pattern of behavior that can lead to a chaotic and unstable lifestyle. In the next section, we'll delve into the causes and risk factors associated with antisocial personality disorder. The development of antisocial personality disorder is a complex puzzle with multiple pieces. Researchers believe that both genetic predispositions and environmental factors intertwine to create fertile ground for this disorder to take root. It's not as simple as pointing to a single gene or a specific childhood experience. Instead, it's the interplay of these elements that contributes to the development of ASPD's characteristic patterns of behavior. A genetic predisposition for ASPD might remain dormant in a nurturing and supportive environment. However, when those genetic vulnerabilities are exposed to a toxic environment, the likelihood of ASPD manifesting increases significantly. ASPD is a result of a complex interaction between nature and nurture, a delicate dance between our innate tendencies and the environments that shape us. Let's delve deeper into the genetic component of this intricate disorder. While antisocial personality disorder isn't directly passed down like eye color, research suggests a significant genetic component. Family studies have revealed that individuals with a parent or sibling diagnosed with ASPD have a higher likelihood of developing the disorder themselves. Inheriting certain genes might increase your vulnerability to developing ASPD, but it's not a foregone conclusion. These genes might influence brain chemistry, emotional regulation, or impulse control, making individuals more susceptible to environmental triggers. It's not about identifying a single ASPD gene, but rather understanding the complex interplay of multiple genes and their influence on behavior. While genetics lays the foundation, childhood experiences play a crucial role in shaping the trajectory of ASPD. Childhood serves as the foundation upon which our emotional and social skills are built. For individuals who go on to develop ASPD, early experiences often involve trauma, neglect, or inconsistent parenting. These adverse childhood experiences can leave lasting scars on a child's developing brain, influencing their ability to form secure attachments, regulate emotions, and develop empathy. In such an environment, the child learns to prioritize survival and self-preservation above all else. They might develop a distrust of others, a diminished capacity for empathy, and a reliance on manipulation to get their needs met. Trauma and neglect can disrupt normal emotional development, making it challenging for individuals to form healthy relationships and navigate social situations effectively. In addition to genetics and childhood experiences, researchers are also exploring the role of brain function in ASPD. Advancements in brain imaging technology reveal potential neurological factors contributing to ASPD. Studies show differences in brain structure and activity, especially in areas responsible for impulse control and empathy. While these findings offer insights, brain differences alone don't dictate behavior. Next, we'll explore the challenges of diagnosing ASPD and the criteria used by professionals. Diagnosing antisocial personality disorder is a delicate and intricate process. Unlike some physical ailments with clear-cut tests, ASPD diagnosis relies heavily on observing behavioral patterns and understanding an individual's history. Mental health professionals must gather information from various sources, including interviews with the individual, conversations with family members, with the individual's consent, respecting privacy and ethical considerations, and observations of the individual's behavior over time. Adding to the complexity is the fact that many individuals with ASPD are skilled at concealing their true nature. They might present a charming and charismatic facade, making it challenging for even seasoned professionals to recognize the underlying disorder. This is why diagnosis often requires a considerable investment of time and careful consideration of all available information. One of the most significant hurdles in diagnosing ASPD is the lack of self-awareness often exhibited by individuals with the disorder. Because their thought processes and behaviors are so ingrained, they might not recognize their actions as problematic or harmful. In their minds, they are simply navigating the world in the way they know how, often justifying their actions as necessary for survival or success. This lack of self-awareness can make it challenging for individuals with ASPD to understand the need for treatment or to engage in therapy effectively. They might view therapy as unnecessary or even pointless, believing that everyone else is the problem, not them. This lack of insight is not a sign of malice or deliberate manipulation, although it can certainly feel that way to those who have been hurt by their actions. Overcoming this barrier of self-awareness is a crucial step towards effective treatment and positive change. While ASPD is typically diagnosed in adulthood, the seeds of the disorder are often sown much earlier in life. Mental health professionals pay close attention to an individual's childhood and adolescence, looking for signs of conduct disorder, a behavioral disorder characterized by a pattern of violating rules and the rights of others. Conduct disorder can manifest in various ways, including aggression towards people and animals, destruction of property, deceitfulness, theft, and serious violations of rules. While not all children with conduct disorder go on to develop ASPD, it's a significant red flag that warrants attention and intervention. By identifying these early behavioral patterns, mental health professionals can potentially intervene earlier, providing support and resources that might mitigate the risk of ASPD developing later in life. Diagnosing ASPD is not a simple checklist exercise. It requires a comprehensive and multifaceted approach that takes into account an individual's thoughts, feelings, behaviors, and history. Mental health professionals use a variety of tools and techniques to gather the necessary information. Clinical interviews, for instance, whether structured or unstructured, allow clinicians to delve into an individual's history, exploring their relationships, work experiences, and any legal issues they might have encountered. Psychological testing provides insights into an individual's personality traits, emotional functioning, and behavioral patterns. And with the individual's consent, gathering collateral information from family members or others who know the individual well can provide valuable context and corroborate information shared during interviews. This meticulous approach ensures that individuals receive an accurate diagnosis, which is essential for developing an effective treatment plan. Treating antisocial personality disorder is a complex journey. It requires a multifaceted approach tailored to the individual's specific needs and challenges. One of the biggest hurdles is that individuals with ASPD often don't seek treatment voluntarily. They might not perceive their behavior as problematic, or they might be resistant to change. Treatment typically involves a combination of psychotherapy and, in some cases, medication to manage co-occurring mental health conditions like depression or anxiety. The goal is to help individuals understand their thought patterns, develop healthier coping mechanisms, and build more positive relationships. Setbacks are a normal part of the process, and it's essential to approach treatment with patience, understanding, and a willingness to adapt the approach as needed. Psychotherapy, also known as talk therapy, plays a central role in treating antisocial personality disorder. It provides a safe environment to explore thoughts, feelings, and behaviors. Cognitive behavioral therapy, or CBT, is effective for ASPD. CBT focuses on changing negative thought patterns and developing adaptive behaviors. Therapy helps improve interpersonal skills and build empathy. Therapy for ASPD can be challenging, but experienced therapists manage these difficulties. While there's no specific medication to treat antisocial personality disorder itself, medication can help manage co-occurring conditions like depression, anxiety, or substance abuse. Antidepressants or anti-anxiety medications might be prescribed to create a stable emotional foundation. Medication management should be overseen by a qualified medical professional. Medication is not a quick fix, but can be valuable with therapy and support. Treating antisocial personality disorder is not a sprint. It's a marathon. It requires ongoing effort, commitment, and a strong support system. Family and friends play an invaluable role. Emotional support and encouragement can make a significant difference. Support groups offer a safe space to connect and share. Remember, change is a process, not an event. As we conclude our deep dive into antisocial personality disorder, it's essential to acknowledge the profound impact this complex condition has on individuals, families, and society. Imagine a stone being dropped into a pond. The ripples signify the impact on those around them, family members, friends, colleagues, and even strangers. ASPD is linked to criminal behavior, substance abuse, and other societal issues, creating a ripple effect that touches many lives. Despite the challenges of antisocial personality disorder, hope exists. Early intervention and ongoing support can improve lives. Imagine a neglected garden. With care and the right tools, it can be restored. Similarly, with patience and understanding, individuals with ASPD can develop healthier behaviors. By educating ourselves, we can challenge stigma and support recovery, encourage seeking help, and offer support. Change is a process. There will be setbacks, but hope flourishes. Together we can create a brighter future. Please like the video and share it with others. It can help those who are suffering. Thank you for watching.